I'm warning you, it's full.
Oh, blimey.
Okay, we'll try and get through as many as we can with these. I'll just randomly pick them out. Okay, so the first one. Having grown up watching the news during the times of the Troubles and the Cold War and being perhaps unaffected, what would you recommend to parents regarding news programmes such as 6 p.m. news, which is graphic as it always was, with murders, COVID and war, to name but a few? Parent of 8-year-old twins who are beginning to understand news content.
That's a really tricky one because it is everywhere. I think in an ideal world you'd want to limit what children and young people are seeing, but obviously, you know, they are very aware of what's going on. You know, even if they're not watching the news, they'll be picking stuff up from their friends or, you know, on social media if they're a bit older. I think, again, it's that worry time and that worry talking to children and being honest. Actually, kids value honesty more than anything else. They'll know if you're talking bull, quite frankly. So I think it's about talking to them realistically, talking to them about the reality. Yes, these things are happening, but actually where we are, we're quite safe, and my job as a parent is to keep you safe, and we will try and do this. These things are happening in, you know, Ukraine and in other places, not here where we live. But validating their anxiety, so saying to them, I understand that you're really worried about this. However, what would help you to make you feel safe? Because it's about building safety for our young people. And you as parents are their safe space. So I think it's just being honest and kind of limiting what they can see. And if they do see it, answering their questions as openly as you feel able to. I think that's probably
I think, and as you say, Sarah, getting the feedback from the child as to what would help them make them feel safe is really critical with that, because sometimes as adults we can think of things that will make children feel safe that don't at all. So hearing the child's voice in that is just so critical. So thank you for that.
Might be something as simple as, you know, just giving them an extra hug.
Thank you. So how can we improve communication between teachers and parents around issues of anxiety and helping children to deal with this?
Gosh, if I had the answer to that.
I was going to be very interested to what you're saying.
Again, I think the interface between education and parents is massive because, as we said earlier, you know, for you guys in Ireland, was it 910 hours children in school for? I'm not quite sure what it is in the UK, but I know we're in an awful lot more because you get more holidays than us. But what we're finding is that actually through the project that we're delivering and the school service that we're doing is that the communication is massively improving because school staff are being able to talk to parents more and being able to come up and say, actually, you know, Stephanie was not quite herself today. Is there anything that we need to be aware of as teachers that, you know, might be a worry for her? Because then the school and parents are aware. And if that's not sort of able to, those conversations are not able to be happening, it's about how do we encourage those conversations to be happening. So for us, it's around working with our pastoral teams and kind of opening doors to having regular conversations and parents not being afraid to say, actually, do you know what, we've had a really rubbish week this week, such and such has happened, this has happened, because the child's in the school as well. So, you know, as John was saying earlier, you're in loco parentis, so you are that parent in the time that they're in school. You're there to keep them safe, you're there to look after them. If you don't know what's been going on in home, you know, could be that there's been a bereavement, but school don't know that there's been a bereavement. So the child then is understandably not focusing, working, listening. So I think it's how do you build those relationships, and I think it starts with you guys as parents in feeling confident to go to the teachers and say, do you know what, I've had a really bad week this week with so-and-so, this is what's been going on. And then those conversations will flow. And it's that open and honesty.
Okay, thank you. And this parent's asked, how do you help a child who always sees the negative in things? And they've given an example. It's a lovely sunny day, and the child says, yes, but there are clouds in the sky.
But the clouds move away. It is really hard when you've got a child who can't see the positives from the negatives. And I think, you know, one of the things you can do is as I was saying in the workshop, that actually you've got you could do like a gratitude log. So actually getting them to really focus on things that have gone well. And they could be as simple as, I went to school, I got out of bed, I had a shower. It doesn't have to be big, grand, huge things. It could be little wins. I didn't argue with my sister when I got out of bed in the morning, I didn't wallop her. Those things could be good things. So actually, if you can get the children to then start thinking about what's going on or going well, then that can then sort of overcome the negative stuff, because you can say, but actually, these things happened today that were actually okay, so it's not all a bad day. And I think it's about being honest and saying to the children, actually, you've told me that these 3 things happened and really good. So actually, today isn't as terrible as it was made out to be. I think, the gratitude stuff is great. And if you Google gratitude logs and gratitude diaries, there's tons of info. And you can create a gratitude log, like with the worry boxes. You can get them a special notebook and things that they can then write their good, positive things for the day in. And then at the end of the week, you can then go back through and say, look at all these great things that have happened that you've put in your book. So the child then owns it.
Very good, thank you. Start good habits. Yeah,
absolutely.
What can I do to help my 11-year-old daughter who seems to mask things in school and explode with me at home? We have had school refusal from her since COVID pandemic.
Yeah, let me just think what I would do. I think, it goes back to trying to unpick what that's about. So if I was working with that child, and I think it's about finding somebody who that child can work with, whether that be within the school or at home, and just sort of finding out what's triggered that. So if it's started before COVID, the likelihood is that something around the COVID pandemic is what's the cause of the anxiety. So are they worried about COVID and bringing it back into the home? Are they worried about how their friends are being? Has something happened with their friends during the COVID lockdown that then's meant that, going into school and seeing those young people and their friends again is challenging? Because as we talked about the avoidance cycle, it sounds like it's an avoidance way. So rather than focusing on what they're doing, it's about unpicking what happens at the beginning.
And it strikes me maybe the slide you did around the problem solving and exploring the options might be a useful technique. Absolutely. In terms of structuring that conversation a little bit. And
some children really like that structure of that. For some children it can be a bit too much, but actually if it's a good starting point to kind of really think about what you can do. And just to remind people, they will get the slides if you fill in the evaluation. But you will get the slides. So all of those kind of things that Sarah had up as tools and everything will be there. The next question, Sarah. Sometimes anxiety can be shown as anger and confusion. What are the best ways of dealing with a child whose anxiety turns to anger? Again, it's finding out what's causing the anxiety. We know particularly in boys, they tend to show their anxiety more outwardly. So they're more often the ones who get into fights, who will punch walls, who will, be a bit more destructive, rip things up, tear things up, throw things, etc. So again, it's putting in some of those techniques that I've talked about that you'll get in the slides. But it is about listening and just bringing them back down and talking to them about other strategies. So when you get anxious, rather than punching, getting angry, what could we do instead? So the grounding techniques are really good if you've got anger, particularly things that involve exercise. So, we had one young lad, I think he was about 11, who would come in and he punched holes in the doors and things like that because he'd been anxious. So Mum bought a punch bag and put it up outside. And actually what he did was come in and did some boxing, and then he actually ended up going to boxing classes. So he channeled his anger and anxiety into the anger part into a more constructive play. Rugby's great, again, because you get that heavy impact, but it also teaches the sports and things also teach them discipline. So we have a lot of people who say, well, if I teach them boxing, they're going to just know how to hit me more. But actually, when you go to classes and things like, karate and taekwondo and things, part of the ethos of the teaching is around the boundaries and rules and regulations that come with the sport. So what we tend to find is actually they become much more aware of how to channel their energy in those ways rather than it spilling out, because they're worried that the dojo karate club is going to, if he hears that he's been using the techniques outside in a confrontational way, he's not going to be able to go back to the classes again. So we tend to find that sort of does tend to work quite well.
Okay, thank you. What advice do you give to professionals dealing with children with ongoing and resolvable stressors, for example, housing?
I mean, housing is a huge issue. And you know, we touched on it earlier, the kind of socio-economical stuff that actually is, as professionals and people, we can't always control where we're living and how we're doing that. So if there's possibilities as professionals, if it is a housing issue and there's overcrowding, I don't know what the situation is in Ireland, but we have housing associations and there's waiting lists for different houses. If you're in a one-bed flat and you need a 3-bed because there's umpteen children and you're all overcrowded. But we will write support letters and we will help other professionals put together a case as to why the housing is causing an issue, and actually saying, you know, we know that there's a waiting list, but please can these people be moved up the bandings because, and we'll list, you know, they've got 3 children, 2 of which are under services, 1, they're sharing bedroom, they're different genders, they're struggling. Actually, this is now starting to impact on their mental health because of the mould in the property, etc. And more often than not, those letters of support give gravitas to supporting that and shifting up. But there is no easy solution because it's outside of our control. I think it's about acknowledging and validating that actually it is pretty crap and there's not a lot we can do about it, but we really recognise and we're willing to do what we can to try and help move things forward. We don't have the answers for everything, and I think there is that sort of perception that actually for us health services have got the answer to absolutely every situation and scenario. We don't. We can only just do what we can do, and if that involves writing a letter to housing to say, actually, this family really needs to move because this child is struggling as a result of their housing, then we can do that.
Okay, thank you. Often I can see my child is anxious and it is hard to get to know what it is that's bothering her. It takes time. She will be boarding next year 5 days, so we will only have the weekends and telephone calls to talk about things. How can I help her to talk about her worries? How can I encourage her to share her anxieties?
Again, in regular communication, things like the gratitude log or the worry book. So things that then when you come home, you've got the list you can set aside however long you want to have to talk about those worries, I think would be quite useful. Okay.
Is it normal for children to experience anxiety when their parents have anxiety?
Yes, in short. I mean, it's not always the case, but yes, there is, as you know, we said earlier, there is that element of learned behaviour. You know, as I say, for me, my anxiety around snakes comes directly from my mum's anxiety, and it's learned from that. But I think as parents, if we put in those strategies and kind of recognise that if we role model and model some of those behaviours and put some of the things that we've talked about this afternoon into practice, then actually maybe that anxiety might decrease. And, you know, we can teach the skills to move forward. And
sometimes, Sarah, I presume it might be appropriate that a parent gets support themselves for their
Absolutely.
own anxiety as a way of supporting their child as
well. So for us, we, as well as doing our one-to-one work directly with the children, we offer parent-led intervention, which actually sometimes might touch on teaching parents skills through the CBT. And if it sort of goes a little bit above what we can offer, we've got what's called Steps to Wellbeing in our area, which is our adult access to psychological therapy, which means that the parents can then go on and actually have support in their own right to manage some of their needs. And it might be something that the parents never noticed before or never acknowledged, but through the work from us has actually recognised that maybe there is something that I need to be working on myself so that I can help my child in the future.
And this is a question, actually, that's come from your talk this morning. So if you can remember back that far. Interested in how the mental health workers in the school were trained. It seems key to have this in place. Did you link with the university to design the training? Is play therapy used at all? If a child needs to be heard and hasn't the words, this seems a useful intervention.
So the model is, at the moment for us, is purely a CBT model, although we have now just started to trial some counsellors within some of the services because we recognise CBT isn't everything. In terms of play therapy, that's offered by our early help services. So some of their teams will be trained in play therapy, as will some of the pastoral support in school. So again, I think we were saying earlier, if they're open to and having other things, we may still work with the family anyway. In terms of the EMHP training, it's a university postgrad certificate, diploma. So they'll do the certificate first of all, and then they do the additional module to take it up to a diploma, which is the education delivery. So that's what makes it different to a kind of wellbeing practitioner element. But as I say, all of those courses are going to become accredited with the Psychological Society, so which is great news, because it will mean there's a professional body, and you'll be able to look up your EMHP or your wellbeing practitioner and say, yep, this person is legit. Whereas at the moment, that's not quite there yet, but by the end of the year it will. So yeah, we work very closely with the universities, so they work with us on us delivering the programme, because when they're in uni, they're with us as part of their placements. So it is a recruit to train model at the moment, just to get the workforce in. And we work very closely across the areas. So for us in the southwest, we use Exeter University, but there are other universities across the country that are delivering that, and they've been working with NHS England and the Department of Education to create the bespoke course specific to this team and this role, based on the rollout of the wellbeing practitioners, which came first, which goes into general sort of healthcare.
This next question is an early years question, so I don't know whether you have the expertise in that. If you don't, that's fine. We can follow up with whoever it is, but I'll ask it anyway, okay? A child has started bedwetting and stealing from creche. I fear she's internalising anxiety and worries, and this is resulting in unusual behaviours. She won't talk about it. What strategies would you recommend?
Generally for us, if they're really early years, we've got our health visitors would take up that role. So we would be signposting to health visitors and our paediatricians to look at the kind of bedwetting side of things. But we, again, if depending on what's going on in the wider family, we might then offer the parent-led work. So we wouldn't work with somebody that young directly, because cognitively they're not able to, but what we can do is work with the parent. So again, it might be that multi-agency approach of working directly with the parent around the anxiety, so the parent feels more supported in managing that, but the other elements would be dealt with by other agencies, predominantly our health visitors.
So whoever asked that question, if they want to talk to Claire, who's right at the back of the hall, Claire, you might wave your hand there. Claire's our early years services manager, and she can link you in with whoever it is with the appropriate services if you want to do that. What recommendations do you have to help children apply the various techniques to overcome anxiety? A lot of resistance from an 11-year-old to use the techniques, very stubborn child who's overwhelmed by what she needs to do to help herself.
That's really common.
Even that might help somebody to know that.
I mean, you can't make a kid do something that they don't want to do. All you can do is plant seeds and just reinforce and make suggestions and sort of try and encourage them to do it. 9 times out of 10, they'll start doing it in their own time, but they just won't tell you that they're doing it, or they'll do it in a slightly different way to the way we've taught them, and they'll get, see, I am doing it. But I think it is just a case of, we're not there at that level of intervention to be demanding a child takes it on board. We can give them the skills, we can give them the strategies. It's very much up to them if they want to use it. But the idea being is we've planted a seed, and that's all you can do, really.
Okay. Your last question. Are you pleased to hear? Is pulling out hair a sign of anxiety or an unhappy child? Who should I speak to about this behaviour? An occupational therapist or a psychologist? And it's from a parent who is concerned. So
it's actually got a proper name, trichotillomania, which I'm quite impressed that I remembered that off the top of my head, to be honest. And yes, it does form, and it does come under the anxiety umbrella. It can be seen under the kind of remit of OCD, so it can become quite a habitual, repetitive, so it's a safety behaviour. So things are going wrong, I'm going to pull something out, things feel better, so I'll keep doing that. Quite often it's either children we've worked with, eyelashes or eyebrows, or sometimes hair, so you'll get patches of hair in the top of heads. So yeah, I think, as I say, I'm not 100% sure of the Irish kind of setup, but I would be speaking to your GP for a referral into somebody who can, whether that be psychological support or through CAMS, but it is something that certainly in the UK we would be working with under that anxiety umbrella.
So GPs are always a really important first call in that kind of layer. So if parents are here, and I'm sorry wasn't able to get to all the questions because we will obviously finish on time and let people get away, but if there are concerns that haven't been got to, your GP as your first line of call is really an important support. So thank you, Sarah, and thank you for giving all the time for those questions.